Hi, I'm Eric, and welcome to this week's In Focus on Whitewater Community Television's WGTV Channel 11. Thanks for joining me. I really do appreciate it. Going to have a chance to speak in just a moment to a new guest, someone I have never had a chance to speak with before, but this is going to be a good, fun, interesting conversation is what I'm hoping. I do want to point you back, if I can, to last week's show. If you have not had a chance to check that out, I would like you to do that because the bulk of our conversation at the beginning of the program was focused on an event that's actually happening this Saturday, May 10th. It is the second annual Sierra Burton K-9 Legacy Trials. The guests on the show were Sergeant Amy Miller, Detective Scott Glover, and Patrolman and K-9 handler Kiefer Uphouse. They talk about the second annual trials, the foundation in Sierra's name, and what the funds are going to. Hopefully you get a chance to check out that show, and definitely, if you can, on the 10th, go out to the Coleman Center and check out the trials. The police officers are very interested in showing you what their canines can do and how they train them and what the canines enjoy. We have some footage of one of the canines running around our parking lot a little bit, and it's just a really good event, and it's for a worthy cause. So I ask you to check that out, and we'll go forward, and hopefully May 10th we can find you out at the Coleman Center. Again, I want to welcome to our show the president and CEO of Wayne Healthcare in Greenville, Ohio, Jeff Subler. Jeff, thank you very much for being here. I appreciate it.
Yes, thanks for the opportunity.
We had a chance back in January to talk to Terry Flood, your Vice President for Business Development and Marketing. We had a great conversation, talked about some of the things that were happening in February around your hospital. So I'm glad that we can kind of continue the dialogue and let people know what's going on with Wayne Healthcare.
Yes, we appreciate the opportunity. And even though we're in a different state, we're just a few miles away from Richmond and Darke County, and appreciate the opportunity to share our message with the folks in this area.
A lot of people go back and forth across the state line. You've got relationships here in the Richmond area that we talk about, and you know you've got that Indiana, Ohio side that you play both sides of. Before we get into some of that, though, provide a little bit of background, because we had a chance to talk just for a few minutes before we went on the air, and your background to me was a little bit interesting.
Yes. So I've been at Wayne Healthcare for 18 years. And I've been CEO, just finished my 4th year as CEO. So I came on board actually on the construction side, facility side of things. The hospital was ready to build, expand, first expansion, which we opened in 2010. So I got to work on that. And then as I've joked before, throughout the process, got added more responsibilities on the non-clinical side of things, and didn't say no fast enough a few times, and ended up as a vice president for a number of years. Then when my predecessor retired, interviewed and got the CEO job, and started that really in the midst of COVID. So you talk about a great learning curve, and thrown to the fire, thrown to the wolves a little bit. Did that right out of the gate. But I'm a lifelong resident of Darke County. Live in Versailles, Ohio.
Okay.
From there, so really Wayne Healthcare, Wayne Hospital. When I was born there, back in the day, and it's been my hometown hospital and healthcare services. So it's really neat to kind of come full circle and lead that organization, and great people too.
You stepped into your role in the hospital. You mentioned as CEO just a year or so after COVID began. Talk about what that was like, watching that, and how your team has come out of that with some of the changes that you all have had to make and that healthcare has had to make. Yeah,
it's hard to believe that it's been 5 years. It certainly seems like a lot longer than that when you're in the midst of that process and what went on there. And it was COVID was a little bit different for everybody. Certainly healthcare, we were in it from the very beginning, but where you were at, the timing of it, how much you were affected by it, we were all affected at some level and greatly in other areas. For us, really, I came on essentially 1 year after the pandemic started, but really we were starting to see the effects of it that year. And that second winter, I'll call it, we were hit really hard with cases. The region, the Dayton region, and really Ohio and including Indiana, I remember we were transferring people to Indianapolis and to Cleveland and to wherever we could find them because the Dayton market was saturated. So we really spent my first 18 months just, I'll say, surviving. What was next? How do we get through this? How do we support staff? How do we support our patients in our community? And so we came out of that pretty good. Looking back in the midst of it, again, it was tough, but it really reshaped the workforce in healthcare, and for us, especially rural, that was probably the number one thing that we are coming on the backside of it, but quite frankly, healthcare overall lost a lot of people. They got out of the industry, and even those going into the field, I think a lot of folks took a pause or took a step back, and maybe they were thinking about going into health sciences, maybe stopped and said, well, maybe I don't want to do that. We're seeing a shift kind of back towards more people getting into healthcare, whether it's nursing or technologists, those types of things, which is good to see. And I think we'll talk a little bit about some of our partnerships with IU East and some of our local universities. We're reaching now down to the high school level, because the pipeline pre-COVID they were already projecting shortages in just about everything, physicians on down. COVID accelerated that, and those numbers got really high. So if there was something positive, a positive that came out of COVID was a real focus about the workforce. How do we get more involved? It's not now just putting an ad in the paper and hope somebody replies to you. If you've got a difficult position to fill, radiology technician, ultrasound technician, could be nursing still, and others, you have to build your own pipelines. Now it's not about, hey, reach out to your local high school, your local career center, your local community colleges or others and say, we are having this issue. Do you have programs? Can we team together to provide internships or work opportunities in the hopes that those folks come back and stay? So we're not alone in that. Pretty much every healthcare industry is doing that, and they're really promoting growing the workforce. Where we're at, Greenville, Ohio, 13,000 people in the city and 50-some thousand in the county, so it's small anyway, a small pool. So you have to kind of grow your own.
Sure.
And that's difficult because recruiting to a small rural facility, that's tough. It's tough for everybody. Some people like the bright lights and they want access to certain things. So we're doing a really good job of creating those relationships, and we're starting to see the fruits of that labor a little bit. We hope that continues over time.
You talked a little bit about the rural nature of where you are. How did that affect what you all were able to do in terms of coming out of COVID? Because you're already in a smaller area, everything seems to compact around you to a certain extent. You're hit harder, I think, in some ways with things, whether it's people who passed away, whether it's people not wanting to take those jobs. You're seeing that. So how are you all changing what you do? And I know you talked about the schools and things, but how you work with your staff and how you think about the mental health of your staff. And I know that was a big part of what came out of, for some hospitals, COVID, the mental health of their workforce.
Well, burnout became really entered the lexicon in many regards across all staffing, especially healthcare. And you're right, small facility. We're the only hospital in Darke County serving those 50,000, and our market area, extends out around it. But during COVID, we were the source. We were the hospital. We teamed with our providers and others in the community. We were the ones they looked to because everybody else was dealing with it as well. So it wasn't like, well, you know what, we'll just go somewhere else. Most places were overwhelmed. So we were the resource. So during that time, we partnered and we did drive-through testing and all of those things that a lot of folks did. But we had to go. There was nobody to help us. So we had to do it ourselves. And again, not alone in that, but suddenly you're rallying the troops to say, hey, we have to be that person. We have to be that entity for our community, while they're also dealing with their own family members and their own components of COVID. Yeah. So that was really a unique dynamic. And to your point, another good thing that came out of that, really tied to workforce, was how do you support your current workforce, your existing workforce? How do you battle the burnout or really the stress of that type of thing? And so there became a focus on your wellness programs, and we were fortunate that kind of during right before I took over, we opened our latest edition, which had a huge wellness center component of that, which is for the community, but we also do a lot of programming for our employees. So how do we provide wellness checks and wellness programs for our employees as well? Employee assistance programs became a big focus. And so how do we support those? One, we want to keep them as employees because we know it's tough to find replacements. But how do we get them working at their best? How do we keep them from going down that path of too much stress or too much burnout? And it affects their jobs, affects their family life. And those are our people in our community. They're the people we see in the Kroger or at church. And so we want to support them as well. So we are doing a lot of wellness type of events for our employees, and we've won a couple Healthy Worksite Awards. We've invested in some employee assistance programs, and we're doing some things even now at the physician level to say, hey, if a physician is feeling some levels of stress or burnout, how can we help them? Of course, physicians, they're champions of everything, and they don't like to kind of say, I need some help. But there's a really strong focus coming about to help those physicians before they get too far along and really feel that burnout. So yeah, we've really supported our staff, and we'll continue that. And some of that can even just be surveys to say, hey, what would help you? How can we help you through this process? We'll talk a little bit later about some of the fun things we do to support our staff, with May being a very busy week with that, hospital week and other things. So that's a big component of it.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're having a chance to speak with Jeff Subler, who is President and CEO of Wayne Healthcare in Greenville, Ohio. Appreciate the time. Did what you went through then increase your partnerships, or were some of these already in the works? And you mentioned a partnership. Obviously, you're looking for students in your area, but wider area with Indiana University East, Indiana Wesleyan, Ball State. Did those increase from the pandemic, or were those things you were already working for?
We were doing it at a smaller level with less groups. What the pandemic came out of that was, hey, we need to reach out to multiple organizations. We've had a long-standing relationship with Edison State Community College out of Piqua, my neighboring Miami County in Ohio. They have a really strong nursing program, and they've always done rotations and clinicals through them. So we went out and said, okay, it can't just be them. We need to build bigger pipelines because, again, most healthcare organizations are doing similar things. Mm-hmm. So I believe we reached out then, really kind of blanketed across to our neighbors here, because we do have a lot of employees that work for us from the Indiana enrichment area, and those that we know that work in Greenville and Darke County as well that we serve. So we reached out to IU East and Indiana Wesleyan and Ball State, as you mentioned. And really, what's been interesting is those were all started. Really, that first outreach was nursing, because that was kind of the big need. Right. But we like to describe it as we're a city. So people think of healthcare as doctors and nurses and maybe some techs, but we're a city among ourselves. So that's
24-hour-a-day city.
24-hour-a-day city. So we need radiology techs and ultrasound techs, and you need folks that work in the lab. But it's billing, and it's finance, and it's registration, and it's facilities, maintenance guys, housekeeping, dietary. We run the gamut, and we're always looking for help from those. But we reached out to those and said, well, hey, wait a minute, we're having trouble with, name it, XYZ. Mm-hmm. How about housekeeping, or how about billing clerks and those types of things? So I know for a fact that IU East agreement, that we have kind of a memorandum service agreement, it's nursing, but it's also really any other any other avenue of education. If someone wants to do an internship or looking for work for an accountant or really any level, we're open to that. And we have that list and we have that agreement, so they can reach out to us. And if they have someone they want to place, we can interview them and those types of things. Same thing for at Sinclair, it's a community college out of the Dayton area. We were having a really hard time with radiology techs, and they had a program. So we reached out to the program and said, hey, do you have some students that need some clinical rotations? They can make some money. We'll train them. There's no guarantee, but we hope that, if they like the experience, that we can, after they graduate, we can hire them. We've had some success there. And now we're doing it for respiratory therapy. It's respiratory therapists, which obviously COVID was a big component of that.
Yes.
So we're expanding our reach and also and expanding the service lines that we're approaching schools about. And even we're talking to Miami University in Oxford and kind of trying to build that and saying, hey, they have a nursing program, but they also do physician assistants and some other things. So we're doing a lot more outreach to those schools, even again down to the high school career tech level, to say these are our needs. This is the outlook for these jobs in the future. Hey, here's the pay range for these. Healthcare is typically a well-paying career. You can come out with a 2-year degree if you want. The hospital will help get that 2-year degree if you want to work for us, or if you have a 2-year degree, you want to get to a 4-year degree, we will help pay for your tuition. So I think we're exposing a lot of that, doing a lot of outreach to say, hey, if you have an interest at all, we can help guide you, get you some work on the side, make a little money, and if you want to stay, you've got a job waiting on you when you're done with school. So that's been neat to see, and I think it's kind of opening the eyes up of some of these students that are coming out that there's some real opportunities for us in this area. So. And
they may not have to leave home to get it.
You don't have to leave home, and we're 35 minutes up the road. Yes, there's a state line there's a line on the paper on the map, but it's no different than driving 25 to 35 minutes one way or the other, and you can really live and work where you want to.
You said something earlier, and people hate when I do this, but you mentioned some people like the bright lights, and they prefer to be in larger areas. But I would imagine that after what some of those hospitals went through in those larger areas, are you finding some people looking for something a little bit smaller, a little bit more rural on a regular basis, trying to slow down their pace just a touch? Yeah,
and I think there are folks that are predisposed to that and that like that pace of life. One thing we do is we try to keep track of folks that are from our area that maybe go off to school in that, because if they're here from this area, they know what to expect and what's around, and we keep tabs on that, because it's a little easier to say, hey, come to Greenville area or Darke County. They know what that means.
Come home.
If someone grew up in New York or even Columbus, in Nashville, they don't really know what that is, and sometimes it's a culture shock for those folks. But I think there's COVID also put into to society really that hey, maybe it's slow down. Maybe the pace can be a little slower. It doesn't have to be the 24/7 nightlife and busy roads and waiting in traffic. The remote folks now that have to go back to work that were doing remote for years, they're not real happy. Mm-hmm. So hey, maybe if you live in a more rural area, you don't have to. We don't have a traffic jammer for us is if the tractors are out and you got to take some time to get to your destination. So I think that has helped a little bit that folks are a little more open to residing in smaller places. And really, from our perspective, we try to say, listen, all that stuff is less than an hour away.
Yeah.
If you want to do that on occasion, if you want to have a different place to go out to eat, if you want to hit the malls, if you're in Greenville, you can drive to Richmond. It's 30 minutes away. If you want to go to Dayton, it's anywhere from 30 to 45 minutes away. Heck, Indianapolis and Columbus, an hour and a half. Less than 2 hours, you can be in the big city. So it's not that big a deal. So, and cost of living's better. Cost of living's a lot better than their bigger cities, and schools are usually better, and it's just a different environment. So COVID did help with that. It's still tough to recruit. You still got to get them there, but I think they're a little more open to that style of life.
I noticed in your 2023 community benefit report, one of the things that you wrote, toward the end of 2023, the hospital began taking steps to achieve critical access hospital status in 2024. We're into 2025,
Yep.
So I have to ask, how did that come about? Did it take place? And what does it mean for the hospital and for the patients?
Yeah. So we actually were hoping to do that in 23, but we had another little project called Epic, and I'll just briefly touch on that.
Okay.
Epic, if you're familiar with MyChart, that's the patient portal side of Epic, and a lot of folks know what MyChart is. The majority of hospitals in our area are on Epic, and that's the electronic health record. That's where all of the stuff, the doctor's chart, the nurse's chart, your x-rays, your labs, all of that gets contained in your electronic health record. And Epic is the market leader in the country. There's 3 or 4 large ones. Epic has about 55% of the market in the country, and growing. They're a very large company. So we made the decision in 22 to pursue Epic, so we could get on that platform. And the advantage for the patient and the community is, if you go to any facility that has Epic, your record is available if you go to another facility. So Reed is on Epic, Wayne Healthcare is on Epic, the Dayton hospital systems are on Epic. The majority, I would say the majority of the Indianapolis or the Columbus, the Ohio State Health Network, they're on Epic, and many of those around us. So if you happen to be seen at one other facility during your time, a doctor's office, anything that's on Epic, your record is in Epic. So if you happen to go to another facility for another service, all of your records are there. You don't have to worry about, well, you know what, I need to tell them that I did this 6 months ago at another facility. It's all right there. And our clinicians were really drove that, our nurses and providers, because for us, before we got on Epic, you could get the data, but it was a really lengthy process to do that. So if someone was seen at a different ER a week ago and came to our ER, our doctor had no visibility of that.
Right.
And that's difficult for physicians. So we went through the Epic project, got on that platform, much better for us as a community and as an organization. So we did that in 23. So back to the critical access. We had known about, we're tracking a change. Critical access is meant for smaller rural hospitals. And what it does is it puts you in a different reimbursement category for your Medicare patients. Puts you in a different bucket. And it's meant to support, it really was created and meant to support your small hospitals, and small can mean different things, are at a disadvantage when they're treating, keeping the finances up, because typically patient volumes are low or they fluctuate so much. So critical access was created to support those, and especially in rural, and it's not just a Wayne Healthcare, but most rural hospitals, you're Medicare dependent. The majority of your patients are on Medicare, and for us, we've been Medicare dependent for many years, which means at least 60%, 55 to 60% of your inpatients are on Medicare. For us, we're closer to 65 to 70% Medicare. And the demographic in Darke County is old and getting older. So we know that's not going to change. So we never qualified for critical access prior to that, but they made a change in late 22. Really was about distance to other hospitals. It was the change. I won't get into the weeds, but we qualified with that change. So we tracked it. It got approved at the federal level. But because we were doing Epic in 23, we said, okay, we want to pursue this, but not now.
One thing at a time.
One thing at a time, because Epic's a huge, huge thing. So right after, really at the beginning of 24, we started the process to get changed. It involves getting resurveyed, and there's a number of things that you have to kind of get set in place to do that. The short version of the story is we got critical access status mid-year, July. We were approved. It took us another 3 or 4 months to get things situated with the federal government. CMS and those types of things don't handle change real well. So we worked with them on that. And really, to start the fourth quarter, we were officially critical access. So we're just now seeing kind of the benefits of that. And again, it really puts us in a reimbursement category for Medicare patients, which helps support really all of the stuff we're doing. For the patients and community, it really doesn't. It's pretty transparent to them. From whether it's a critical access or acute care, that's the other side of it. So they don't really know. Same services, it doesn't restrict our ER, it doesn't restrict our surgery, it doesn't restrict our pain management, those types of things. It's more internal. There are a couple operational components that we have to monitor because basically it's meant for smaller hospitals. In a different world, if we were to grow and be a 100-bed hospital, we could not be critical access. But we don't have to worry about that. So we have to just monitor some operational components. Really the big thing for us is because it alters the reimbursement for Medicare. It supports all the other stuff we're doing for the community. We still do labor and delivery services for the community. We want to keep that going, even though that's tough in a rural environment. It helps support all the other stuff that we're doing at the hospital. And it's a big change for us.
Obviously, you are watching what is happening for our hospitals and things over here on the Indiana side. We were watching what our state legislature was doing. They just wrapped up. Obviously, they're listening to what's coming out of the federal. Your state legislature is going to start. Are there concerns in terms of health care and maybe even reimbursements?
Yeah, certainly that's a hot topic now federally. If you at all read the news and watch the news, and for your mental health, it's best sometimes to turn that off. But I agree. But the state of Ohio is actually just wrapping up will be wrapping up their state budget as well. You mentioned Indiana's just wrapped theirs up. So Ohio does it every 2 years. So theirs is due by the end of June. And we have a really strong lobbying organization. The Ohio Hospital Association does a really good job fighting for hospitals in Ohio. And we've been fortunate. I don't want to jinx it, but we've been fortunate with our governor over the last number of years. He's been very supportive of healthcare in the state of Ohio. That doesn't mean it's all roses, but he's been very supportive of healthcare, and we expect that the state budget will be positive for us overall, especially rural. Now, Governor DeWine is done in a couple years, and then who knows what's after that? Nobody does. But really, the focus has been at the federal level, and all the discussions about Medicaid. Medicare gets brought up every once in a while, but Ohio was one of the states that expanded under Medicaid a number of years ago, and the discussions around slashing the budgets at the federal level really does translate down to the state because the states administer Medicaid dollars, and there are discussions at the Ohio State House about, hey, if the federal government slashes too much, if they fall below a certain level, we're going to cut our component too because we're not footing the rest of that bill. So that's concerning, and that could equal tens of really hundreds of millions of dollars not in the system anymore if the federal government does something and the state says, well, hey, we're not going to pony up that money. So we're watching it pretty closely. I did have the opportunity to go to Washington, D.C. To do some advocacy for us as rural health care back in March, met with our local legislators. It was a good trip. They're all well aware. They've been hearing from most healthcare organizations that the damage is, especially for rural, is if you cut that funding. Just like I said, critical access helps kind of float everything else that you're doing. If you cut that funding, it cuts access to programs that you want to provide. And if you kick a bunch of people off of Medicaid, those folks are not going to seek care until it's absolutely necessary or too late. And then you're in your ER, and by then they've got something that maybe could have been caught weeks ago, but they're not going to go see the doctor because they don't have coverage, those types of things.
It becomes a cycle.
It becomes a cycle.
Nobody wins. The hospital doesn't win. The patient doesn't win.
And that's been the focus for a number of years, the population health. And really, the best way to reduce healthcare costs is to keep people out of the system or get them before things get too far along. If you're talking about diabetes, those types of things, if you manage their issues all along or up front, the cost to the healthcare system is a lot less than if you let them get too sick and then they get in and suddenly they're doing a lot more intensive procedures and those types of things. And in rural, the labor and delivery crisis in this country is bad and getting worse, especially in the South. And even in Ohio, there have been 15 labor and delivery units closed in the last 5 years. And you think, well, that's a lot. That is a lot. And when those services go away, they don't come back. There's no, well, you know what, if we get a little more money, we're going to hire some OBGYNs and have our labor and they don't come back. And so when those services go, or you lose some physicians because you can't support them, they don't come back in a rural area. And so we tried to impress upon our legislatures that we understand fraud, waste, and abuse, and we understand that if someone is gaming the system, get that out of the system. That harms everybody. But you can't just take a hatchet to the programs. That indiscriminate cutting just harms people. And when your local hospital can't provide that service, then you are driving an hour away for something. If your daughter or granddaughter is having a baby and they had a 10-minute drive to the hospital and now they have a 45 or an hour, things can happen. So we want to encourage our legislators to support health care, work on the problems. We all know healthcare has problems, and it's tough. It's a complex business. It's expensive in this country. We all understand that, but there are ways to work on that without harming the patients and the community that we're all trying to serve. So that's been a real interesting piece. And really some of that came out of COVID too. The struggles that COVID, right. The financial pressures that came from COVID, they're affecting the government as well. So how do we deal with that, and how do we advocate for health care in general, and especially rural health care in our parts? We want to preserve that and preserve the health of our community.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11, or maybe you're watching this on our YouTube channel or on our Facebook page. However you're spending time with us, we greatly appreciate it. We're spending time with the President and CEO of Wayne Healthcare, Jeff Subler. Jeff, we talked about honoring some of your workers and things of that nature. May is littered
Yes.
with a chance to show some support and love to those who work in and around the healthcare system. We're actually in Nurses Week this week.
Yes, I think tomorrow is National Nurses Day, and May has been historically a large month for recognizing healthcare. So we have it's Nurses Week this week. Next week's National Hospital Week, and then there's EMS Week the following week. And we do a lot of things at the hospital for nurses. Usually, food brings the masses together. So we do a lot of treats. There's some recognition. We have a Daisy Award that we give out this week for a nurse that's nominated for their good work, usually by a patient or a family member. We do that, and then. For Hospital Week, we do cookouts, and we do special prizes and giveaways for staff. Everybody seems to enjoy that. I think last year we actually had a dunk tank and did that.
And you spent how much time there?
Well, unfortunately, I had a meeting that I couldn't get out of.
Timing's everything.
I think I got ribbed for that a little bit. But they're trying to find another opportunity for a dunk tank and put me on that. But it's fun. It's fun to get everybody together in those situations and do that. And certainly for EMS Week, I think we bring in food trucks and we provide free meals for any of the EMS groups in the county that work with us and do that, just to support them. Obviously, they do a critical job for 911 service and transportation for the community. So we want to support them. So it's fun. It's fun. It's neat to see those. Folks get giveaways or we, like I said, we do cookouts and I'll go in on third shift myself and a couple of my leaders, senior leadership. They cook up hamburgers and we go deliver them for third shift on the night before. So folks appreciate that and it's just fun to be around and see everybody having fun while we support them for all the good work that they do.
It's important to let those folks know how important they are to the entire system and the community.
Absolutely, absolutely. And they serve our friends and family. And we're all, we see them, like I said before, we see them in church, we see them in Kroger. Those are the people that we're serving, and it's good to support them.
When we had Terry here in January, we had a chance to go through a couple of other things. We've talked about some of the weeks, but you all always have, it seems, something going on that you're trying to share information and education with your community. On the 19th of May, you've got a Look Good, Feel Better, Helping Women with Cancer, an event coming up and taking place. Want to talk about that for a minute?
Yeah, that's we have a really strong cancer program at the hospital, and we also have a cancer center in Greenville that we're a partner in. And there's a Cancer Association of Darke County, which does a great job. And this one's a kind of a special one. The Look Good, Feel Better, that's for folks that are going through chemotherapy and may lose their hair and have other issues. It helps them. They do makeup. They bring people in to do makeup tutorials. They have some wigs available that they try on. And really it's about, hey, we know you're going through this terrible thing. But it doesn't mean you can't look good, and that helps them feel better. And we've had some great responses to that program, and it's great to support those folks that are going through that. It's just a neat little program that they have.
And the next day, something that it continues to grow. I haven't had a chance to play yet, and I probably shouldn't say that around here. But your orthopedic team has put together some information. Pickleball injuries and how to treat them. That is a growing sport, and I'm sure you're probably seeing more injuries from that. Your orthopedic team is,
yes,
at least.
Yes, and that's really how that came about. So we have a great partnership with Orthopedic Associates. They do all of our orthopedic surgeries at the hospital. We have a great surgery program with them. We've really doubled our orthopedic cases in the last 2 years with them. It's been a great program. They're a great partner in the area. But really came out of a discussion, kind of at first joking around about all these buildings going up that are housing pickleball. Most tennis courts now are being converted to pickleball.
Yep.
And it's really a sport that's just blown up and from young to old. And really it was about, it's great. It's a great sport. It's great to be active, but they see a lot of ankles and knees, and folks that maybe hadn't done that kind of strenuous activity for a while are now getting into pickleball, and it's a real thing where more injuries have come out about that, and so, like I said, we kind of said, well, joking, hey, it's kind of a feeder for maybe we should do a session on pickleball and how to avoid injury and treat injuries.
How to warm up well.
How to warm up, those
stretch,
types of things.
yes.
So that's how that came out. It was, hey, that's actually a pretty good idea. So we want to get the word out. It's a Healthy Moments, and we'll have one of our orthopedic surgeons there to talk about how to do pickleball safely and get better, because it is a great activity. And I haven't taken it up either. My wife started doing it a little bit, and she keeps trying to nudge me to take that up.
You'll be out there soon.
I would be one that would hurt my knee and need to get it fixed. But that's a great program coming up on that, and we encourage anybody to see that.
Jeff, we appreciate the time you've given us. Before I let you go, I need to ask, is there something that I haven't asked you, we haven't talked about, that you really want the community to know about Wayne Healthcare?
Well, I think it's just that, even though we talked about it before, that there's a line on a piece of paper that says, Ohio and Indiana. We have a lot of folks that work for us, that work in Greenville from the Richmond and greater Richmond area. We're just across the road, essentially, in Darke County. So we want to make people aware that there are programs that are available to them, whether they're have to travel from here or they're working in Darke County, and want to make them aware that we're just a stone's throw away and have a lot of good programs available. We do a lot of stuff in our wellness center, Tai Chi. There's some Parkinson's classes that we've have some good participation from Indiana residents. So really, it's just we want to get the word out that we're not really far away, and there's some opportunities to take part in some of the classes we're doing in community education and wellness events.
Nice. We appreciate you taking the time and coming over and continuing the dialogue that we're having to spread the message about Wayne Healthcare.
I appreciate the opportunity.
We're going to take a break. We'll be back with this week's Master Gardeners episode with Beth Treaster as we continue with In Focus on Whitewater Community Television's WGTV, Channel 11.
I'm Beth Treaster, and I'm one of the Master Gardeners here in Wayne County. The Master Gardeners work under the training of the County Extension Agent, and it's all a part of Purdue. We are very grateful that Purdue Extension has given us this opportunity to share about our love of gardening. We've been discussing the people who might be planting who for the first time, how to have some ideas of first where to put your garden and then what to plant. Today we're going to look at when to plant different vegetables. Now I'm sitting here on this beautiful sunny day, and I want to take this perspective that spring is here, I can put anything in the ground, it's time. Or maybe I already have my raised bed built, it's time to plant anything. Well, no. In Indiana, we can't be certain about the last frost. Really, the for sure safe date is the middle of May. Sometimes I will put out plants that can't take cold. I will put them out on Mother's Day. If the forecast is warm coming up, but even that's iffy. And if those of you who have been gardening a while, you've probably had the experience of thinking, oh, everything's fine, and then here comes a cold snap and out you run with your blankets and your buckets to get everything covered up. Well, so if you're new to gardening, there are two categories of plants. There are two ways to divide them: cold season and warm season. Okay, in Indiana, we have two cold seasons, spring and fall, and one long warm season, May to October. So we plant our garden accordingly, the plants that need each of those seasons. Now there's another way to divide plants into two categories. Long season, the ones that have to grow for months before you get a harvest, and short season, things that are ready to eat, say in 6 weeks or 2 months. So when you're planning what to put in your garden space, you want to adjust those two factors together. So if you for sure want to grow tomatoes, and who doesn't, as they are the #1 favorite garden vegetable, you're not going to set those out until the middle of May. Well, what's your garden going to do in the meantime? And let's say, for a different example, let's say that you love peas and you plant, those are a cold season crop. Let's say you plant those in March, you eat them in May, at the end of June, here comes the heat and the peas die. Well, then what's going to happen with your garden? Okay, I want to give you a word, a gardening term that's really useful. It's called succession gardening. When one vegetable's done, put in the next. When that vegetable's done, put in the next. And two big reasons for this. One, of course, it's more productive. You get more food out of your space if you get more than one crop. The other reason is it's not good for soil to sit bare. And we talked earlier about how we now know that the ground underneath us is full of microscopic life. Bare soil is starving. The little creatures have nothing to eat. The little creatures are happy when there are either plants growing and their roots coming down, or mulch. So all the time we want something on the ground. So as you look at your favorite crops, decide what you'd want to plant early. Like at my garden, at the end of February, I planted peas and onions. And now at the end of March, well, except it's been so wet. As soon as it gets dry enough that you can work the soil, then you'd want to put out your lettuces and chard and beets and carrots and so on. Those are all cold season crops, and you can eat them and they'll be done by hot weather. Except chard. Let me come back to chard again. You're going to think that's kind of my soapbox is Swiss chard. It starts early and goes all summer. It is a true cold weather and warm weather crop, but that's unusual. Most crops are one or the other. So I've got my cold season crops in, and I've got my warm season crops started, and we'll talk about that in the next episode, how to get ready when it's time to put out the warm season crops. Because by May, the days are long and glorious and we're all excited and we just can't wait to see our things grow. Well, there's things you can be doing even while it's still cold and wet and rainy to get ready for May. So we talked about how I started with my cold season crops, and then I'm getting my warm season crops ready. But fall comes. Now you might think, okay, when my tomatoes freeze in October, then I'll plant a cold season crop. Not quite that simple. Here's why. In October, the days get short. If you put a seed in the ground in October, it will not really grow because there isn't enough light. So our cold season fall crops, we start in August, and we have to protect them from the heat. But we get them growing, and then when the frost comes, all the warm season crops freeze and the cold season crops take off and will produce for us into the winter. Now, I've thrown a lot at you today about short season, long season, cold season, warm season, and all that. How do you keep track of what you're going to plant when and where? Well, a simple map. I make this master diagram of my garden beds. Doesn't have to be anything fancy. And then I make multiple copies of this. And then each year I pencil in what I'm going to grow. So I'll have 1 potatoes, that's my spring crop. And then I have 2 Chinese cabbage. That's my August into winter crop. So you can put a succession of crops in each bed. It may change depending on weather conditions, etc., but at least you've got a guide. And then save these from year to year to keep a history of what works in your garden. So there's lots of options. Be thinking about what you want to eat, what you have time to take care of, and what fits your schedule of cold, warm season, and have fun doing it. We'll talk next time about getting ready for warm season. Thanks for joining us today. Again, I'm Beth Treaster. I'm with the Wayne County Master Gardeners, and it's fun to be part of this In Focus program.
SmartHub is a web and mobile app that allows you to do business with us like never before. You can manage your account, view and pay your bill, monitor your uses 24/7, report outages, and receive important notices, all in the palm of your hand. You will be able to save time and money with features like paperless billing, auto pay, and much more. For more details on SmartHub, visit us online. Presented by Richmond Power and Light, your locally owned electric utility, building Richmond a better tomorrow.
You are watching Whitewater Community Television, Cable 11.
Since 1988, Whitewater Community Television, WCTV, has been a trusted source of local programming for Richmond, Indiana, and all of Wayne County. Located on the campus of Indiana University East, WCTV has spent decades connecting our community with coverage you won't find anywhere else. From local events and government meetings to educational programming and original shows, WCTV is dedicated to informing, engaging, and celebrating the people and stories that make Wayne County unique. As a PEG station standing for public, educational, and government access, WCTV serves the community through 3 distinct channels, each playing a vital role in local broadcasting. WCTV on Channel 21 is our public access channel, a space where community members can create and share their own programming. From talk shows to area church services, it's a platform that gives our residents a voice and a place to share their stories. WETV on Channel 20 is our educational access channel dedicated to learning and school activities. It features a variety of educational content, from lectures and projects to local high school and college sports coverage. It's also home to much of our original programming, including The Third Sector, which highlights nonprofit organizations making a difference. Inside IUE Sports, keeping fans connected to Indiana University East athletics. And Access to the Arts, showcasing creativity and talent from across our region. Additionally, Let's Talk Together, In Your Business, and many other programs provide platforms for meaningful conversations that matter to our community. WETV is also where you'll find coverage of other area sports, holiday events, and parades. WGTV on Channel 11 is our government access channel, ensuring transparency by broadcasting an average of 250 unedited and unbiased city and county council meetings, advisory boards, plan commissions, public hearings, and other government-related content every year. These broadcasts keep you informed about the decisions that shape our community. WGTV does more than just broadcast government meetings. It serves as a vital hub for civic engagement in Wayne County. It's home to In Focus, our long-running public affairs program. WGTV also brings you live coverage of important civic events like our In Focus candidate forums and election night coverage, ensuring that the moments that matter most to our community are accessible to everyone. Together, these 3 channels uphold the mission of public access television by fostering community engagement, lifelong learning, and open government communication. Behind every broadcast, every event, and every program is a small but passionate team of professionals and students from IU East and area schools who work tirelessly to bring WCTV's programming to life. They're not just broadcasters. They're your neighbors, your friends, and your community members, many of whom who grew up right here in Wayne County. Their dedication ensures that our local stories are told, our voices are heard, and our community stays informed and connected, both on television and across social media. Watching WCTV is easier than ever. All 3 of our channels are available to Comcast subscribers in Wayne County. You can also stream WETV and WGTV live on our website at wgtv.vibit.com. And most of our content is available on demand through our YouTube channel. Stay connected with us on Facebook, Instagram, and X, where we share updates, highlights, and behind-the-scenes moments from around the community. Since 1988, Whitewater Community Television has remained committed to keeping our community informed, engaged, and empowered. Whether you're watching city council meetings, local sports, educational or musical programs, or original content, WCTV is here, your trusted source for local coverage, community connection, and programming that truly matters.
The video you just saw was our latest attempt to give you an idea of the scope of work that Whitewater Community Television has had the privilege of doing for the community for a number of years, since going on the air in August of 1988. We hope that we will continue to be able to do that, but as you have probably heard, read, or seen, the cost of doing business for us as well as for other media companies continues to go up, and how we handle that, how we evolve, and how we are able to continue to serve you is a question that is still being answered by the Whitewater Community Television staff, some of our community partners, and others. So we are taking a hiatus from In Focus, as we are from some of our other programs. We are narrowing the scope of the work that we are able to do for the community in hopes that we can, as we go through this time, begin to figure out what our model needs to look like, how much we can actually be able to do, and how much the community, honestly, is willing to support. So for those folks who have been guests on In Focus or PI Live even before that, to those who were guest hosts during that time frame, for the candidates who showed up on the In Focus Candidate Forum and our In Focus Election Night specials, we thank you. We thank you for watching. We thank you for listening. We thank our partners over at Whitewater Broadcasting, G1013, and their sister station, ESPN Radio, 1490 AM, 100.9 FM, WKBV, for airing this program through the years. Our thanks to, my personal thanks to all of the staff of Whitewater Community Television who, through the years, have provided support for this program, whether they were directing or whether they went out and shot B-roll or just helped with camera operation. My special thanks to Ryan Harris, who has been in my ear for the years that we have done this, has been my director, has been my friend, has been my confidant, and someone to laugh with as we go through this. I am not saying that this is the end of In Focus. My hope is that we will be back, that we can continue to share information with you about our community. But for now, thanks for watching, and as always, I wish you well.